Hello and welcome to Triage, rapid legal lessons for busy healthcare professionals, a podcast created and produced by K&L Gates. Each episode is designed to highlight important developments in health law and analyze the impact on our clients and friends of the firm. We hope you enjoy this podcast.
This is Hannah Maroney in the Research Triangle Park office. I am an associate here. I'm joined today by my colleagues, Steve Pine, who's a partner here in the Research Triangle Park office, as well as Cheryl Choice, who's an associate in the Pittsburgh office. The topic of today's podcast is going to be HIPAA privacy concerns in the context of coronavirus. I'm initially going to turn it over to Cheryl to kind of give some color and context on the virus itself, and then Steve and myself will dive into those legal concerns. So Cheryl, I'll go ahead and pass it over to you.
Hi, Hannah. Great to be here today. As you mentioned, I'm a Pittsburgh-based healthcare associate at K&L Gates, doing work in the regulatory sphere. And while earning my master's in public health, I developed a strong interest in health law. So it's always nice to have the chance to discuss the intersection of the two. So just to go a little bit in depth into the background of the coronavirus, the 2019 novel coronavirus, or COVID-19, a disease that is caused by a previously unknown virus, which is called the Severe Acute Respiratory Syndrome Coronavirus 2. So as such a new disease, the World Health Organization, CDC, and other public health agencies are updating the public as they learn more about the disease. Estimates of the R0, or basic reproduction value for coronavirus, have been between 1 and 4. This means that each infected person, on average, will infect between 1 and 4 additional people. And for reference, the R0 for measles is between 12 and 18.
Thanks for that, Cheryl. I was also wondering specifically if you could outline the common symptoms of coronavirus while we're talking about all the other aspects of the virus itself.
Sure. For most cases of coronavirus, the symptoms are quite mild. The symptoms generally are respiratory problems or gastrointestinal distress, but in some cases it can result in pneumonia, kidney failure, or even death. But the fatality rate is not yet known, although experts estimate that between 50 and 20% of cases are serious enough to require hospitalization. And unfortunately, there's currently not a vaccination or a specific antiviral treatment for coronavirus, although they are being researched.
Thanks, Cheryl. And with that context, Steve and myself are going to go ahead and dive into the legal concerns, specifically in the context of HIPAA. As most of you are aware, the HIPAA privacy rule protects a patient's privacy with respect to protected health information, or as many refer to as PHI. The HIPAA privacy rule is applicable to covered entities, and that includes health plans, providers, and healthcare clearinghouses. Both OCR, or the Office of Civil Rights, and the CDC have published materials addressing concerns and questions with respect to coronavirus. These agencies have outlined several overarching themes, such as the continued concern for patient privacy in the wake of coronavirus, and the importance of avoiding the social stigma that results when such privacy is not maintained. In OCR's bulletin, the agency emphasizes that even in an emergency situation, covered entities under HIPAA must continue to implement reasonable safeguards to protect patient information. In the reference bulletin, OCR also outlines particular instances in which it may be permissible for entities to disclose protected health information in certain situations and discusses specific examples of certain situations. Particular examples include in the context of a patient's treatment or the treatment of a different patient, in the context of public health activities, disclosures to family, friends, and others involved in an individual's care, and disclosures to prevent a serious and imminent threat. With respect to the first example, covered entities may disclose protected health information necessary to treat patients or other patients without written authorization. Going to pass it over to Steve for the next example.
Thanks so much, Hannah, and really happy to join you. My name is Steve Pine. As Hannah mentioned, I'm a partner in the RTP office, focusing on health law with a specific focus on health privacy issues, and appreciate you inviting me to talk about what's a very important and timely topic in terms of health privacy. So the second area that OCR describes in the bulletin, providers will see coming up frequently in the context of COVID-19, which is disclosures to public health authorities. So this includes entities such as the CDC on the federal level, but as well as state and local health departments. And what the HIPAA privacy rule says in regards to public health activities is that covered entities are permitted to disclose information, including protected health information, without individual authorization when directed to do so by a public health authority in order to ensure public health and safety. And OCR gives the specific example in respect to COVID-19 that covered entity may disclose to the CDC protected health information on an ongoing basis as needed to report all prior and prospective cases of patients exposed to or suspected of having the novel coronavirus. One thing to keep in mind with all of these categories, with the exception of treatment that Hannah just discussed, is that HIPAA's minimum necessary rules will apply. What that's going to mean in the context of public health activities is covered entities should be thinking about what the information the public health authority is specifically requesting and be tailoring the information it provides to that request. However, HIPAA makes clear that covered entities are able to rely upon the public health authority and what the public health authority requests when determining the extent of what would be permissible under minimum necessary guidance.
In cases in which a hospital or other covered entity is conversing with a public health authority, should also be noted that in many cases, the public health authority itself is going to take over certain disclosures, whether that is to the media or to that patient's family or other affected members of the community in that initial instance for disclosure. The next example provided by OCR are disclosures to family, friends, and others involved in an individual's care. OCR notes that a covered entity may share protected health information with a patient's family members, relatives, friends, or other persons identified by the patient as involved in the patient's care.
Thanks, Hannah. And in the context of that, the patient's identification of family members or relatives or other persons that they want to share that information with, OCR notes that the covered entity should obtain at least verbal permission from individuals or otherwise be able to reasonably infer that the patient does not object when making those disclosures. The next and another important exception on when PHI can be disclosed are disclosures to prevent a serious and imminent threat. So the general concept here is that healthcare providers can share PHI with anyone as necessary to prevent or lessen a serious and imminent threat to the health and safety of a person or the public, consistent with applicable federal and state law and the provider's standards of conduct. So a couple things to think about and note here. First, the threat, in addition to being a serious threat, also needs to be an imminent threat. So in the context of COVID-19, healthcare providers will need to determine whether certain actions that they would take that would involve the disclosure of PHI would be necessary in order to stop an imminent threat. So one scenario in which this might come up is a hospital determining what procedures it needs to take, consistent with what policies might already be in place, in order to notify individuals coming into the hospital or otherwise maneuvering around the hospital about sections of the hospital that may contain individuals who have COVID-19, such that any persons traveling through that part of the hospital have the appropriate personal protective equipment in place. Again, the healthcare providers and hospitals will generally have policies in place already discussing what kind of personal protective equipment will be necessary in respect to infectious diseases. But in the context of COVID-19, as we learn more about that disease and as hospitals experience a significant influx of patients, something to keep in mind to the extent that PHI can be posted publicly as necessary to prevent a serious and imminent threat. So, that could be in the context of signage that would identify patients as having COVID-19 in a particular area. What OCR says under HIPAA is that they expressly defer to the professional judgment of health professionals in making that determination about both the nature and the severity of a threat, as well as how imminent that threat is. So there's a good bit of flexibility here on covered entities, but again, they just need to be thinking about this in the context of the experts on public health, as well as what's the minimum necessary information that can be disclosed in order to sort of balance those competing interests of preventing an unauthorized disclosure of PHI and potential stigma associated with that, along with protecting public health.
Thank you, Steve, and thanks to Cheryl as well for that context. We here at K&L Gates will continue to monitor the development and insight into the coronavirus as we learn more, as well as how such developments will affect legal concerns such as HIPAA privacy and other developments in the healthcare law arena.
Thanks again for listening to Triage, rapid legal lessons for busy healthcare professionals. New episodes are available for download through iTunes, Google Play, and other podcast applications. By subscribing to Triage, you will receive timely notifications of each new episode. Also, if you have any topics that you would like to hear discussed on Triage, please don't hesitate to email triagesupport@klgates.com. We would love to hear from you.